My name is Nada, I'm 57 years old and my goal is to keep going.
I'm Julianne, I'm 51 and I want to live till I'm 101.
My name is Prue, I'm 71 years old and I want to live life to the full.
After a biopsy, I was told by my breast surgeon, who the very first time I ever met her, and she was able to tell me straight up what type of breast cancer, because there's different types. I wasn't shocked when I found out. I was prepared, and I was prepared with questions.
I was having a shower and I noticed I had an inverted nipple and it wouldn't come out, and I thought, this is not me. So I contacted my doctor, and it was at the beginning of the week, and it happened all very fast. Doctor, breast surgeon, plan, tests, everything. It just rolled on from there. So that's how I got the news.
I was visiting a friend who was just had a breast cancer surgery, and that reminded me to check myself. And that's how I found, the same night I found the lump myself. It all happened really, really quick. And I had biopsy the next day, saw the surgeon the day after, and he confirmed that it was breast cancer.
She said, no, your breast cancer is only stage 2 and it's a very good chance we can get a recovery for you. So that I went out feeling like I'd been given back a life. And I set about then, in a fairly determined way, to make the most of my treatment. And if it worked, well and good. If it didn't, that was it.
I know people that have had breast cancer, and I was pretty sure that that was what my diagnosis was going to be. And in that week of anxiety between, say, the ultrasound and biopsy and then getting to see the breast surgeon for the results, I had come to terms with it. I guess, I'm not saying it was, not a little bit of a shock or a bit of this is what we're dealing with.
I wanted to be realistic. I suppose I'd got that from my husband, not to be too optimistic and think, right, it's all cured, because I had a serious illness, and whilst over 50% get better, there is a percentage that don't. So I wanted to be optimistic as well as realistic.
Well, I'd sort of already made decisions before I even had my diagnosis, which had to be altered based on what the actual diagnosis was. But I'd already decided that I wanted to have a double mastectomy or a bilateral mastectomy. I felt that that was going to give me the best chance of survival.
Didn't really feel like I had much of a choice. You were more or less put on the roller coaster at the beginning of the treatment, and this is what we're offering you, and we can cure you. We feel very confident about curing you if you take our treatment, and I accepted that. I didn't question it. I didn't go looking for second opinions. I liked the people I was seeing. They were being very factual and giving me all the information, and I thought that this is my best chance of overcoming the cancer, is taking this route.
There were basically just 2 options that I understood for breast cancer. If it's just contained to the lump, it's radiation after surgery. If it's gone to lymph nodes, it's chemo and radiation after surgery. And that was it, basically. So he explained all those steps and told me that after surgery I would be seeing an oncologist. So it was all verbal explanation. I did not get any written information at that point. It was all happening so quick.
You have this team of people talking about you every week, this MDM or multidisciplinary team meetings they have and talk about you, and they come back to you and they say, right, this is what the whole team thinks you should do. what do you think about that? And because initially they wanted to, it was suggested that I might do chemo first before any surgery, and I said absolutely not. I wanted the cancer cut out immediately. And so I was determined I was having my bilateral mastectomy, but the team came back to me and they said, we've got another option for you. How about we do a lumpectomy first, get rid of your cancer for you like you want us to, and then you can start chemo 3 weeks after that to get cracking, as she said. Get cracking on the chemo, and then we'll come back and we'll do your double mastectomy for you, which is what I ended up deciding on. So I felt like I had some say in it. I didn't feel like they were saying, right, this is what you have to do. I felt like I had, some choices.
When I first was diagnosed with the cancer, stage 2 breast, they said you're hormone receptive and you fit into the profile of a clinical trial, so that we recommend we give chemo first and then surgery and then radiotherapy, so that you can fit into a worldwide way of the trial of a hormone drug that you take right at the end of the treatment. My husband, being a research background himself, was very positive about joining the trial. He couldn't see any reason not to, and I was very happy. It was sort of a mixture of could benefit me, but if it can benefit others as well, go for it, and we did.
I took my husband with me to see the oncologist, and he saw a surgeon with me as well. So he was there to hear what I couldn't hear, because sometimes you don't always hear everything with everything happening at the same time.
If you question it, you've got knowledge. With knowledge, you've got power, and then the confidence to make your own decisions.
We don't have private insurance, and my surgeon, when we spoke about treatment, asked me whether I had private insurance. And at that time, I was, I think, a bit confused, and I took that question to mean that I should go private. So I said, no, I don't, but I'll pay for it, because we kind of keep a fund ourselves for anything like that. So I went private with the first surgery, and then I realized that I didn't have to go private. So the second one was done in a public hospital.
Got the cancer out, was pretty happy about that. And then my first appointment with my oncologist, she laid out this plan, but I'd done a bit of research myself and read some clinical studies, and I decided that, I said to her, why can't I have dose-dense treatment? And she said, you can have dose-dense, you can have it this way. And that's, she kept saying to me, you're not going to be able to handle it, it's really hard on you. And I knew myself that was the way I had to go. I'm a sprinter, not a long-distance runner.
It started with chemotherapy straight away, and followed by breast surgery, with little gaps to recover, first from the chemo, then from the surgery, and then I had radiation. So that was the course it took.
I had 2 surgeries. First was the breast lump, second was the lymph nodes that were taken out. After that, I had to wait for all wounds to heal, and then started chemo. I had 4 rounds of chemo. They were 1 every 3 weeks. And then after about 5 to 6 weeks break, I had radiotherapy. 10 sessions, I think. Chemo was extremely difficult. For probably 3 days, I could not get out of bed. I was very short breath, swollen, all sorts of things, pains and aches and everything. But it did stop afterwards and then start getting better. And then after those 8 or 9 days, I was back to work for 2 weeks, and then back to another one. So it was quite hard. I read a lot about it before from brochures and everything I've collected over time, but none of them told me that it would be this hard.
I contacted the Cancer Council fairly early in my diagnosis and asked for a relaxation CD and a meditation CD. Got booklets of information on how to advise children, like your grandchildren or family. So I accepted help like that. And I also like to exercise and believed that that would help with the treatment, so I was going walking more and trying to relax. I went to a psychologist partway through. I decided that I wanted some strategies perhaps to help with getting the right balance and looking after myself and Graham, and also future grief and loss that I knew was down the track. And my doctor put me on a care plan that gave 6, I think, Medicare-supported visits to a psychologist, which I took up, and she was useful and helpful and gave me some strategies. And just even talking things through helps you sort out in your own mind how best to do things.
Few things helped me along the way. I went to mindfulness meditation course, which lasted 8 weeks, and that was kind of through the middle of my treatment and onwards, and that helped me a lot. Also, after the last chemo, that depression was lingering. It didn't go away like previously, so I've asked my GP to see someone to help me through that, and I saw a psychologist, I think 6 sessions I had, and that helped a lot. She did tell me that it was a medically induced depression, basically, because of steroids. So what helped also was keeping a diary. I got a diary from the Breast Cancer Network Australia. Like the whole My Journey kit had a lot of information and a diary, and I was told that keeping a diary is actually useful, and it was, because it showed me that after those 3 or 4, 5 bad days, it started to improve every time. So that really helped to know that it is going to finish.
Keeping a medical record, you can take it to whatever appointments, no matter who you see. I think you can sit down at your own leisure and figure it out, like pathology results. I've actually gone back to mine a few times. You know, in that first time you get the surgeon tells you how it is, but then if you look through, you say, okay, this tumour, I owned every one of them, you know, I owned what was happening with it. And I just think it helps to keep things clear, where you've come from, where you're going, and it's a powerful thing.
It's not letting the illness dominate your life. That life goes on, and you should make the most of it, and do what you can. So I wasn't letting the side effects of the chemo, for instance, stop me too much from doing things. I did what I could. Gardening was one of the things I've always enjoyed and loved, and because I'd have to stop some of my regular activities away from home, gardening at home became more important. And it really, I felt the benefit of getting out into the garden and focusing, thinking about what I'd plant, what season it was, what I needed to do in the garden. And when I was doing that, I wasn't thinking about cancer. I say, I don't look after my garden looks after me.
I set little goals in my head. I when they say that exercise is the best thing for fatigue. I mean, I wasn't out there running marathons or anything, but I got up and I walked and I did things. I just tried to do things, and that is true. If you just sit on the couch, you are going to be even more tired.
I found out about breast cancer nurses' existence, or Breast Cancer Network Australia, just accidentally through a friend who had cancer, and she was telling me she had a visit from a breast care nurse, and I said, oh, what is that? So she told me about it, and I then went on the website and found Breast Cancer Network, and also found a breast nurse that I talked to, and then she organized to send me the My Journey kit and diaries and everything, and that was great. That there was a lot of information there. One of the things, for example, was information about or availability of Look Good, Feel Better workshops. So I applied for that, and one was organized immediately, and that was very early after my surgeries, before chemo. So I was able to. That was the first time I met other women who were going through the same issue, and they were all at different stages. So some of them had hair, some didn't. And what I found out about there was that they were talking about wigs, makeup, eyebrows when you leave them, all these things, scarves. I absolutely hated that feeling of a wig on my head, and that was the only time I cried throughout the whole journey. And then I thought, yes, I don't have to wear it. I'll just wear the scarves. And so they gave us information about websites where you can find hats. And I love hats and stuff like that. So that was really good, because I did not wear a wig. And that was very good for me. So there's a lot of information, I think, out there. But it's important to know where to look. I didn't want to look into all sorts of different websites about cancer, because they might not be reliable. But like Cancer Council and Breast Care Network Australia, they're really, really good.
Sex after or during treatment can be tricky. And nobody wants to talk about it. The oncologist doesn't want to talk about it. From what I've read online, it's very hard for women to get help. They might seek out gynaecologist help. And I think that that's an area that we really need to start talking about it. You know, we've taken the taboo off breast cancer. 20 years ago, people didn't talk about it as much. Now let's talk about how it actually impacts on people. I would say ask questions and take someone else with you who's a really strong personality, who will ask questions. It's about being informed. Stay off the forums. If you want to look up anything online, stay off the forums. The forums are just full of people that have got negative stuff to say, right? Look at the websites that have got a .org after them, or,
I think not being frightened of it, that whilst it's a really hard year, the treatment, that you can come through it and you can have a good life after it. Not to be afraid, and to focus on the good things that it brings, because it does bring good things as well as bad. Even the relationship with Graham drew closer, because it's a very intense time knowing that your life could be ending. And it makes you value the things in your world and in your relationships much more. So unless you're faced with those things, you can breeze through life not appreciating so much. So it's not all bad. It's a lot of good there as well.
I guess to people or to other women who would be starting now, I would say be kind to yourself. Try meditation, because it's great. Do exercise. And seek help whenever you think you need help. I think don't be afraid to ask for help, because I think help is out there.
I've been very aware. I don't think I'm going to drop dead anytime soon or anything, but once you've had a cancer diagnosis, I think you're aware that time is short. And that's part of what gives me the courage to speak to doctors and whatever. Like, all the teenagers say YOLO, you only live once. Well, now's the time to speak up. Now's the time to ask the questions. Now's the time to take a holiday if you can take a holiday, or